Hey guys, my name is Paul. I'm the owner of Stand Still Fitness, and this is my mat therapist, Jen. And Jen's been working with me for a long time because one of my secrets is I have trouble running because I have this injury in my foot. It hurts me all the time. I had Jen work on me a year ago, and it was okay, but it required kind of constant maintenance to keep it mild. And recently, I got to talk with a podiatrist who gave me a amnion cell injection. And Jen said, come by, because my healing techniques work much better. And I got the cell injection. It was swollen. I didn't really think it was going to work. I went to Jen's office, and she looked at the site, and then found that there was lack of mobility in my ankle, and helped me basically retrain some of the muscles in the side of my leg. And honestly, when she was doing it, I didn't really think it was going to work. I didn't really feel very much. She said, it's getting better. I'm sitting on a table. I don't feel anything. I was like, you sure? She's like, yeah, you need to do this movement. And then I go home, and then my foot feels better. It was like magic. And so I have Jen here, and I wanted her to explain, what it was that she did to help me, feel better, like in like 4 or 5 hours.
Cool. Well, two things. One, I think it's very important to note that knowing your weaknesses and where you're not strong in your overall program, so your precise weaknesses and overall in your fitness program is really important for success. So admitting that you're not good at running, but you're great at staying fit and going to get even more fit is great. I think that's one of the big reasons why you're going to be successful. Number two, MAT is not magic. Muscle activation techniques is an assessment process that lets the MAT specialist see where you are not able to handle forces. Meaning your body can figure out compensations, but there are most of the time very weak points when there's injury present. So there is a reason why the body has to find other solutions, i.e. compensations, when there's an injury present. Mm-hmm. So what I saw in you is that you had some limited motion in your hip and the ankle and the forefoot. The injury is in the forefoot, near the metatarsals where the toes are. Where I saw the motion very limited and where I saw the motion most limited was in the subtalar joint. Now, what makes me think that I can work on the area that's not injured and still help you heal is the question that I think you were trying to ask when you were on the table thinking this is not going to work.
Mm-hmm. Well, it felt better quickly.
Yeah.
And I think, it helped in part by this injection.
Yeah, the injection definitely helped.
What did you do to help my foot feel better? And you were working on my ankle and my calf a little bit.
Yep. So the biggest thing again is finding out where your body cannot handle forces. Mm-hmm. And by the MAT principles, tightness is secondary to weakness. Therefore, if you're weak, you're going to be tight, mm-hmm. or i.e. limited motion. So by activating all the muscles that do abduction of the foot or pronation of the midfoot, we were able to get the results. So, and I felt that it was getting better because the site of injury, I was actually testing the muscles where the injection was, and they were coming back strong, which was not happening on our first round of treatments many months ago.
Right. So if someone's got an injury on their foot, right?
Yeah.
How is it we can use this kind of combination technique with amnion cell injection with MAT therapy? Mm-hmm. Why is that going to get improved results versus doing just one of them?
Okay. So the first thing, so there's 2 ways. The first one is the same reason everybody walks into my door. If there's an injury, there's an imbalance. Finding out the reason why that injury may exist or where the body cannot handle forces is the thing that's going to be common with everyone that comes in for MAT. So that's the first thing. We have to find out where your biggest muscle imbalances are. Second, with the stem cell injections in particular, or PHP injections, the body has to upload the cells. So it's not like you inject and then all of a sudden all these stem cells are going where they're supposed to be. The awesome thing about stem cells is that they can turn into a liver or a lung. I'm not a genetic scientist, obviously, but they can form into all these different tissues. So that's why they're so useful, and that's why people are storing them for future use. But when you inject it into injured tissue, that doesn't guarantee that the cells are going to upload into that tissue. MAT, with the objective feedback of muscle test, digital application or isometric, and then the second muscle test, you are uploading. We are asking the nervous system, hey, do you know what this position is? Can you detect strength or can you detect weakness? And when you ask that, when you give it the objective feedback, is when the uploading happens.
So what kind of foot or ankle injuries is this going to work for?
MAT or the combination?
Well, this kind of combination. I mean, my injury doesn't really have a known diagnosis. It's some kind of pain between the metatarsals that I have not gotten a clear diagnosis from yet.
But there was an injury.
Yeah, that they could see from the ultrasounds.
You could see that. Plantar fasciitis is something I treat very, very often. I think the 2 things I do the most with MAT and feet are plantar fasciitis and making sure people are wearing the right shoes. So when you're talking about fixing a foot injury, are we talking about fixing something or helping people run better or put their weight better on their foot?
People are in pain, right?
Yeah,
Say if you have turf toe. That's an injury of the tendons running over your big toe. Morgan syndrome, I think, is another common foot injury that people have, or tendinitis in your Achilles.
Tendinitis is definitely a big. But again, the first thing is finding the imbalances, and if there's a chronic tendinitis, we will start where the muscles are, most compensatory. So we might be starting at the hip when you're coming in for a foot injury, and I think that's really important to have that mindset coming into MAT because we're looking at the whole body, we're looking at the big picture. So basically, I think any foot injury could benefit from MAT if you're getting chiropractic work, physical therapy, working with a doctor with the injection type of non-invasive therapy, or coming out post-surgical. We can help with that stuff because we're looking at the whole body. Yeah.
Okay. Well, that's good stuff. So I do refer lots of people who get foot injuries to Jenn. She's helped me a lot. And, the whole major principle is, sometimes you get an injury running or something in your foot, and it's overloading because something else is not functioning. And that's where I've seen Jenn really can zone in and see some other little muscle isn't working, so I'm overcompensating, and the thing that's overcompensating gets injured because it's not designed to hold those forces. And it's really her technique in understanding how to test for these things and find them to help, clients and patients, develop strength so they can stop this biomechanical imbalance that causes the injury, allowing it to heal.
Thank you. Well said.
All right.
So, thanks.